Hey everyone, welcome back to my channel. My name is Kelly and I am a physical therapist and I specialize in oncology, lymphedema, and women's health. Today in this video, I'm going to show how to do lymphatic drainage massage for long COVID-19 or to reduce long-term side effects. Now the first thing someone may ask is, why is this done, or how can this possibly help reduce the long-term side effects? Well, this is part 2 of a 2-part series, and in the first video last week I explained why doctors are starting to recommend lymphatic drainage massage for long COVID-19 or long haulers. In that video I break down the current theories that are shared in the research and medical literature. So if you want more of that explanation, then you want to go ahead and check out that video that I'll put a link to up above here or in the description down below. This video will simply just show the lymphatic drainage massage technique and sequencing that we use. But before we get started, be sure to subscribe down below so you can join us weekly for new videos related to these topics. Like stated in the other video, I am not a researcher or doctor that specializes in COVID-19, but I do specialize in lymphatic drainage. So be sure to always talk to your doctor for your personalized treatment or for clearance for any health concerns, as this is for general education only. So let's get into it. Based on what is suggested in the literature right now, I'm going to focus this lymphatic drainage massage routine on the chest, face, and head neck area. So the first thing we always start with doing lymphatic drainage massage is belly breathing. So placing your hand on your belly, think of your belly into 4 quadrants, just start in 1. You're going to gently press inwards and take a breath in, feeling your belly expand into your hand, but give some resistance, and then out. And then the next section, and then out. And then the third, and out. And when you breathe out, you can gently press in with your hands further, and then the 4th one, and then out. Good. And then we're going to think about the lymph nodes that are in the axilla areas or your armpit areas, and then around your collarbone. There's a lot of lymph nodes that all of this fluid, all of this backup has to go through these lymph nodes to get out of the system. So we always want to make sure that we're just stimulating those lymph nodes. So we're going to take a full hand right in the armpit, and you're just going to start with large circles. You don't have to press hard. You want to be gentle. Your lymph nodes are sensitive in there, and they're right underneath the skin. So doing about 8 to 10 times or 8 to 10 circles on one side. Then we'll do the other side. Doing 8 to 10 on that side, or as much as you'd like. You can spend more time in any of these areas that we're talking about today. After you've done the armpit areas, then we're going to think about the lymph nodes that sit around your collarbone. And so right around your collarbone, you're going to put your whole hand on it, and you're just going to do those large circles 8 to 10 times. Now I'm doing one side at a time. You're welcome to speed it up and do both sides at the same time. That is just fine. Sometimes just the positioning's hard. You would have to cross your hands over, but 8 to 10 times, or you can spend more time there as well. You also have lymph nodes that are on the side of your neck or the base of your neck, and so we're going to do circles there. And I do wrap my fingers around towards the back of the neck a little bit because there are some lymphatic nodes back there. 8 to 10 times, and then we'll do the same thing on the other side. And then after we've done the base of the neck, I'm going to go right below the ears. Your lymph nodes sit at the base here and then also below your ears, and all of the vessels run from the middle of your face out towards that side and then down. And so we're going to go right there. What I usually do is just spread 2 fingers but whole hand, and then as much surface area as you possibly can to do those circles. Now if I feel like I have a cold or I'm sick, I'll just spend some extra time myself just doing this area, and I feel like that works really well for me. And then the other side, it just helps speed up any illness that I feel like is coming on, because it just does stimulate the lymphatic nodes and just speeds up the system when you're sick. So after you've done all of those. Then we've stimulated all of the lymph nodes in the area. So what we're gonna do next is go through and drain out this whole region. All of the fluid has to go back to the heart. But if we start at the top, this is where the congestion is with the long COVID or the lymphatic system, which I talk about in the other video. We don't want to start here because if everything else is backed up, it has nowhere to go. So we always start low and work our way up, and then we'll work our way back down. So I'm going to start down here, and we're going to work at the base of the neck, working the fluid down the side of the neck towards the collarbone. Again, you don't have to press hard. You actually are pretty light. The vessels are right under there for the lymphatics, and your neck has a lot of delicate structures. So what I do is about 8 to 10 strokes down. You can do short strokes all the way down, or sometimes if someone's neck is a little shorter, we'll just do one stroke. You can also do circles downwards, but everything is guiding downwards. After you've done one side, you can do the other, or again, you can do both at the same time to speed it up. But nice and gentle, thinking about guiding the fluid down, kind of like toothpaste in a toothpaste tube, guiding it down out of that area. So we're gonna go through and do 8 to 10 of those. And then what we're gonna do after the side of the neck, we're gonna work underneath the jaw. A lot of lymph vessels are there. So underneath the jaw, think about starting in the middle. You're gonna work everything out back towards underneath the ear. So do 8 to 10 of those as well, just guiding everything back and down. If you look at a mirror, you'll either make a 7 or a backward 7. That's the way the pathways go for the lymphatic vessels. And then I'll do the other side. Just gentle strokes outwards. And again, if this is where you get sick, or you even go to the doctor and they feel for the lymph nodes swollen under here, if you get a sore throat, this is a good area to just focus a lot of time on. But we're just doing it to help clear out the lymphatic system as a whole, so the fluid can move out of the congestion of the head area and the lymphatics. And from there, then we're going to work back down the sides, clear out everything we just did. Now you also have lymph vessels that run in the back of your neck and up the back of your head a little bit, and so we're going to switch to focus on that next. So I'm going to turn so you can see a little bit. All we're going to do is at the base of the hairline. I'm just going to put my hand at the base of the hair, and I'm just working downwards. 8 to 10 of those. You can work into the, up and towards the back of the head a little bit too and pull down, that's just fine. But a lot of them are right to the base of where your hair is, and then just a couple up above. But working down, and then I'll do the same thing on the other side. I know it's hard to see, but again, I'm just kind of massaging downwards. And 8 to 10 times there. Now we're going to work into the face area. So we know again the lymphatics run from the base, or the middle of the face, and they work outwards. And so we already did around the jaw, and so I'm going to work into this area where the sinuses are around the nose. We're going to start in the middle, and I'm just going to work out again towards the lymph nodes where are under the base of the ear, and just gently work outwards. Still try to use as much of your hand as possible, and then be gentle around your eyes. And you can work down lower into the sides of your cheeks as well, but a lot of congestion happens up above. 8 to 10 times there, or you can spend a couple minutes there if you feel like that's helpful. And then after you've spent some time there, however much time you need, you can also work on the forehead area, again middle out towards the sides. So 8 to 10 times outwards as you need to. And then because we're looking at the lymphatics that go up into the head, we're going to go back down around the ear and really focus on clearing that area out, either with circles like we did before, or just guiding downwards, but really making sure you're getting behind the ear. So my fingers are behind the ear and down. And then I'm going to work my way down the neck again and do nice strokes. My fingers are wrapped around towards the back of my neck. I know you can't see that, but I'm just trying to get as much surface area as I can, guiding downwards the whole time. 8 to 10 times there, or again a couple minutes if you like. And then when you finish that, we're going to go back down to the base where the collarbone is, and I'm going to finish again kind of working down past the collarbones a little bit more. Getting through those lymph nodes so it's not backed up there as well. 8 to 10 times, or you can do circles again, either way. And then I'll do the other side. 8 to 10 times on this side. There are also lymph nodes at the middle of your chest, just a few. Most of them are in your armpits, so you're welcome to also do circles or movements down in the middle of the chest or on the sternum and working down as well. After we finish and you've done as little or as much as you want of that sequence and that routine, I always recommend my patients and my clients finish with deep breathing, because that's where a lot of your deep lymph nodes sit. So we're going to go back, put your hands on the belly, take a deep breath in, feel that resistance, and let your breath go. Next one, and out. Third one, and out. And last one, and out. And that's it. Most people will do lymphatic drainage massage 1 or 2 times a day, depending on what their activity level is. Gravity does help drain the lymphatic system, so I always recommend when people do head and neck lymphatic drainage that they are sitting upright or reclined, but their head is propped up. But I hope you all found this video helpful, and I'll see you all next week for another video. Thanks everyone.